So, Dr. Newsom-Davis, what do you think about differences in accessibility and affordability of anti-cancer drugs in European countries? Do you think there is room for improvement, and how?
I think the accessibility of drugs in oncology is one of the big challenges that we all face. I think as an oncology community, we need to be able to find a way that the new drugs coming through for the treatment of cancer are available for everyone, not just for those who are rich and can afford it. In the United Kingdom, the approach that has been taken is an independent body called NICE, the National Institute for Clinical Health and Excellence, which makes a cost effectiveness assessment, and that is arbitrarily set at £30,000 per quality assured life year. And we need to work as oncologists in the government and in the pharmaceutical industry to find a way of making sure that these drugs achieve that level. That's partly going to be done by allowing the development costs of drugs to be reduced. The costs are so enormous to develop a drug from the bench to the bedside that that cost has to be recouped by the drug being funded. The next part we have to think about is whether we can look at the way in which drugs are patented. Can we extend that to allow the drug company to recoup their profits over a longer period of time, and therefore there's a less of a sharp spike in the price of the drug? I think we also have to look at the pharmaceutical industry, and they need to look at themselves and say, how do we make these drugs affordable? Yes, they are expensive to make and develop, but actually producing them once they're made is not expensive. And we need to make sure that they are available to everyone and not to the few. And finally, I think the approach we need to take as oncologists is to make sure we only use these drugs for those who will benefit from them. We should select them. And I think we see that particularly with the immunotherapy drugs. You could argue you can give them to all patients with relapsed lung cancer. And that is possible, but I don't think anyone can really afford that. So perhaps what we should be doing more than ever is identifying patients, use our research, use our technology to identify patients who will benefit, give them the drugs, and be honest with ourselves and honest with our patients for those who won't benefit from them. I think if we do all of those as a community, we have a way of making drugs available to people who actually need them.